seconds.
Hello, welcome to Winnebago County Health Department's TV show, where we talk about public health concerns and relate them to your health. Today, I have a few staff here as guests, and we're going to go ahead and let them introduce themselves.
So my name is Jenna McNeil, and I'm a public health nurse at the Winnebago County Health Department.
And I'm Amy Winninghoff, and I am also a public health nurse with the Winnebago County Health Department.
All right, so you're both public health nurses. What division is your role underneath?
We fall under the communicable disease division.
And can you explain for myself and for the audience a little bit about what a communicable disease is?
A communicable disease is a disease that can be transmitted various ways, person to person, through the air when you breathe in a bacteria or virus, by touching a surface that's infected or an object, also through infected food or water, and also through like insect bites, like a tick bite or a mosquito bite.
So very different from chronic disease.
Yes.
And are there different types of communicable diseases or levels?
Yep. Communicable diseases are put into 3 categories, and that would be from the state of Wisconsin. They've put all reportable diseases into one of those categories. Category 1 diseases are the most impactful. It's kind of based on the severity of the disease and how much it impacts the public health. So those Category 1 diseases have to be reported to our health department within 24 hours, and we need to follow up immediately. Those would be things like tuberculosis, meningitis, measles. The Category 2 diseases are needed to be reported to the health department in 72 hours, and those are the majority of the things we see in public health. And those would be things like salmonella and E. coli, and the sexually transmitted diseases like chlamydia and gonorrhea.
Okay. And there was a third level?
Yep, there is a third level, and that one is reported directly to the state because it is something we don't follow up on initially, and those would be like HIV people.
So do you still get notified when there's a Category 3?
Yes, so for HIV, what happens is the reporting is done to the state, but then the state notifies us locally of the new case. So at that point, then we would do what we call partner services, which would be linking the patient to care, and then also doing an interview with the patient to see who could potentially have been exposed, and then trying to notify those individuals and get them tested.
Okay. So with communicable diseases, what does the health department do locally to prevent those?
Sure. So primarily we track or monitor diseases, and we ensure appropriate treatment, and then we also provide education.
All right. Breaking those down a little bit, what is tracking or monitoring? Can you put those into some examples for us?
Sure. So tracking or monitoring, especially in public health, is a lot of times referred to as surveillance. So people may have heard that term. Basically, we look at what is coming into our county in regards to certain infections. So are we seeing an increase over a certain period of time, a decrease? Surveillance is also done at the state level and also at the nationwide through the Center for Disease Control.
Okay, so when you get that information that's numbers, how do you take it from that group to individual?
Sure. So I guess the first thing is, so for example, for during influenza season, the state really monitors the numbers that are coming in through the state, and then it gives us an idea of what kind of messaging we need to be putting out to our community. Are we seeing an increase in the state, and if so, it should be something we're focusing on. And then also, I guess more at an individual level, we would be doing interviews with anybody that's positive for one of these infections.
What type of things do you ask in an interview?
Sure. So for interviews, we really focus on a few main things. So one would be symptoms the patient's having and when those symptoms are occurring. It gives us an idea of when they are infectious or contagious. The other is making sure that they've been treated appropriately so that, one, they recover from the infection, and two, they're not spreading it to other people. And then the other is providing education, and that's on how they can protect themselves, their loved ones, their family, and also how they can be protecting, the general public health as well.
Mm-hmm. So in that treatment stage, how are we involved there? How do we make sure that the right treatment happens?
Mm-hmm. Well, the state puts out treatment guidelines, and actually guidelines for all of the reportable communicable diseases that public health follows. So there are specific guidelines for treatment, testing, isolation, how to follow up, for contacting contacts, finding people out there who may have been exposed to that infectious individual.
So to put this in real terms, can you kind of give us an example of something?
Sure. So we had a pertussis outbreak last year amongst mostly high school and middle school age students. And pertussis is whooping cough, so it is spread through the air when people cough. So for a pertussis, there is strict guidelines about testing, treatment, and isolation of those individuals. We work with that infected individual to educate them, as well as find out if they know of anyone else who may have the same symptoms. We reach out, make sure that they're treated appropriately, that they're following the isolation guidelines so they don't go out in the community while they still are infectious. And part of our contact investigation would be like, have these people been out in school activities? Are they in a sporting event? Do they participate, in like a theater, church events, things where they may have traveled long distances or gone away on spring break together, things like that, just to help us get information about other people who could potentially be infected.
Wow, there's a lot of background information that you guys go through. So then when it comes to, obviously we want to prevent it, so that education on the forefront, but when we know something's out there, how do we get the word out? How do we tell the public?
So we, one-on-one, do a lot of education when we're doing disease investigation and working with providers as well as hospital infection preventionists with providing the correct guidelines and updated guidelines. We work with school nurses, other groups, as well as our social media.
Right.
Right.
So I remember when the pertussis outbreak was going on, we
Right.
were putting together mass emails and putting it up on our social media. We do have that information for you guys. Our website is www.winnebagopublichealth.org, and our social media is at Winnebago Health. So I think that's a really good place for the public to know that they can go and find information under the communicable disease tab. There's a link right there for provider resources, and it not just for providers to go, but for the layperson to have information and know those guidelines that they should be looking for.
Correct. Yep. We have a lot of information out there on specific diseases and how to stop the spread. We do, as you said, have that provider section so that a provider can go right in and get the specific information they're looking for, or just contact information to get to us, the correct people to give them that information.
Right, and so I'm stressing that too, when they don't know where to go. You guys are the gurus, you know what's going on, and you've been tracking it, so you're probably the quickest answer right there.
Hopefully.
Yeah, and if we don't have the answer, at least we know where to get the
Right.
answer.
Okay,
So,
good. So this time of year, what is it that we're thinking about, we're working on?
Yeah, so a few like national observances, I guess, related to communicable disease. So one would be March 24th was World End TB Day, which TB is tuberculosis. And then the other is April, which is coming up, is National STD Awareness.
Wow, so not something we typically think of as being close to home, but is that a concern for Winnebago County?
So I guess I'll let Amy maybe talk about TB and I can talk about
Right.
the STDs.
So TB is one of those diseases that's not particularly prevalent in Wisconsin, but it is on the rise nationwide. And we have had a few cases here in our county recently, and cases that are antibiotic resistant, making it much harder. And it is something that takes a lot of time and energy and resources as a public health department. So it's important to help educate to stop the spread of that
All right.
disease.
So another health observance actually that is coming up in the next few weeks here is National Public Health Week. And we had staff introduce themselves and let you into our Oshkosh location for a little view. So take a look here at the video to celebrate National Public Health Week. Hello, my name is Alana Erickson, and I'm the Communications Specialist for the Winnebago County Health Department. Today you're going to see a little bit around the building and meet some staff. Come join us.
I'm Stephanie Gildenvan. I am the co-coordinator of Rethink.
My job basically is I'm a health inspector.
My name is Lori Duclan and I work at Winnebago County Public Health. I've worked in public health for 14 years and one of my favorite things, or several of my favorite things, is the variety of work I do and all my people I work with.
I'm a student at UW Oshkosh, and I believe public health is important for students and communities because public health educates students on just different ways how to prevent themselves from getting certain diseases.
Hello, I'm Doug Guerin. I'm the director of the County Health Department. I've been here about 13 years, and it's a privilege to serve in this capacity.
My name is Lindsay Erickson. I'm a health educator at the Winnebago County Health Department. Most of my work focuses on tobacco prevention, and I also do a little bit of work with mental health and suicide prevention.
We are here as a health department to support the community's work, and we also need to recognize that we can't do it without them. So this unique partnership really allows us to have greater capacity at building healthier communities.
As an environmentalist, yeah, it's always important. We always want to make awareness of your carbon monoxide and your smoke detectors, making sure they're working correctly, testing for radon in the home.
Hi, I'm Anna Carpenter. I am the preparedness specialist. So focusing in a lot on what preparedness is and how public health works in the community to make sure that our residents are prepared in the event of a disaster or an event.
Hi, I'm Tracy Gerke, a public health nurse here at Winnebago County, a family child health nurse. So I see new moms and babies, I work with child care centers, do car seats, and I follow communicable disease with tuberculosis being one of my specialties. And my favorite part about my job is I feel like I'm a jack of all trades. I have to do a variety of things at a variety of times.
I'm Ben Rush. I am the Pharmaceutical AmeriCorps member with the Winnebago County Health Department. So I spend a decent amount of my time going into schools and teaching kids about nutrition.
So a lot of our work focuses on engaging with the community and finding ways that we can partner with other organizations or community members to improve the health of the community.
My name is Cindy Draws. I am the Public Health Nurse Supervisor for the Healthy Lifespan group. These that we do here for healthy aging, or promoting healthy aging, and also for our family child health programming. But also within this division is the Well Woman program, which is a cancer screening program.
We are really tasked with improving health for the overall community. That's a very broad set of duties, and we try to identify the ways that we can use our limited resources the best that we can to have the most impact.
And just because we work for public health, it doesn't mean that everyone else in the community isn't a part of improving the health of the public.
Welcome back. That was a video to celebrate National Public Health Week, and that is celebrated nationally in April, the first week of April. We had a lot of help from staff to put that together, and it was a lot of fun. Some students from the UWO Communications also helped put together those videos and work on the footage. Check out our Facebook and our website, where we're going to have some contests and some other information the whole week from April 3rd to the 9th. And that's National Public Health Week. On to another celebration. We're looking forward to next month and hopefully some better weather. In May, we celebrate Bike Week, and that's nationally, regionally. Fox Valley has a ton of leaders that are really working on promoting biking in our communities, and they've fought hard to really make it easier to access places on bikes. So they've got some fun events planned coming up at the end of May here, and we went ahead and made a few videos to share those. Enjoy.
Hi, I'm Emily Deeringer with the Winnebago County Health Department. I'm also co-coordinator of Rethink, Winnebago's Healthy Living Partnership. We're out here at the Wheelwash Trail today talking to a couple of people about the Meet in the Middle ride, which is part of Fox Valley Bike Week, which is happening this year, May 14th through the 21st. So I'm here with Michelle Backus with the Wisconsin Bicycle Federation, also with Rick Helms from Winnebago County Parks Department, and Kim Bieterman. She's the Regional Bicycle Pedestrian Coordinator with the Central Regional Planning Commission. So we've got a cool event coming up on the 21st. It's called Meet in the Middle. Michelle, can you tell us a little bit about how Meet in the Middle got started?
Sure, absolutely. We're looking for some fun activities to bring people in multiple counties together over Bike Week last year. And we were planning a ride from Hortonville down the Wheelwash Trail. I'm thinking Wheelwash Trail, that's Oshkosh. So let's get the folks from Oshkosh coming up north. So you can start by Bare Bones Brewery in Oshkosh, the trailhead park here, head north, and you can start at the Hortonville Public Library and head south and meet in the middle right in Larson.
Awesome.
We're going to have all kinds of fun stuff to do.
Great. So Kim, can you tell us a little bit why it would be a cool thing to do to be part of this event, or why getting on the trail is so important?
Yeah, well, first we all know that riding a bike is super fun, so it's a really great way during the spring to get out on your bike, experience the Wheelwash Trail, which is in our backyard, and what a better way to do it, especially if it's your first time, than to do it with a group of people. Meet in the middle and enjoy some fun during the middle of the event. It's literally connecting communities together by bringing them in the middle, and just a great chance to get out and get some physical activity on what will hopefully be a really nice day.
Right, so speaking of that day, Rick, can you tell us all the details about what time and where and when?
It starts the May 21st at 1 p.m. Like you said, you can see the start at Hortonville and travel south, or you can start here in Oshkosh at the Park and Ride and travel north. And when you meet in the middle, it should be about 2:30. There'll be some fun games and snacks and stuff like that.
Yeah, so we've got some really cool things from a couple different vendors. Fox City Cycling Association will be there, Wisconsin Bicycle Federation will be there. Lots of fun and games and great stuff for everybody. Michelle, can you tell us how people can get involved or how they sign up?
Yeah, absolutely. You can find information about the ride on the Fox Valley Bike Week page. There's an event called Meet in the Middle. Just go sign up, and I think all the local organizations will have something too, but go to Fox Valley Bike Week
on Facebook. Otherwise, just show up on the 21st at 1 p.m. at either the Hortonville trailhead for the Wheelwash or the Park and Ride across from Bare Bones Brewery in Oshkosh. Happy cycling! Have fun!
See you soon!
We're out here at Oshkosh City Hall talking about Bike Osh, a really cool event that's part of Bike Week, May 14th through the 21st this year. We've got some of the event organizers here with me. We've got Daniel and Dylan from Oshkosh Communities at Oshkosh North, We've got Ben Rennert from Winnebago Bicycle. We've got Lauren from East Central Wisconsin Regional Planning Commission and the Safe Routes to School program, and then we've got Alexa from the City of Oshkosh Planning Department. So, Daniel, can you tell us a little bit about the Bike Osh event?
Yeah, so this is the second year of the event, and so what people will do is they'll just bike around to different local businesses here in Oshkosh, and they'll get their sheet stamped, and for every stamp that they get one ticket, and then at the end they'll end up at the Oshkosh Senior Center, and so they'll get a ticket, and they'll be entered into a raffle to win some really cool prizes.
Awesome. So it's kind of like a scavenger hunt, amazing race kind of event, right? Really cool. So, and Lauren, there's something new that got added this year. Can you tell us about that?
Yeah, so we're really excited to be partnering with Bike Osh this year with our Regional Safe Routes to School program. We're doing a bike rodeo portion. That'll be from 10 to 2 at the Oshkosh Senior Center. We're doing a bike rodeo, so we're inviting all families to come and check it out. So a bike rodeo is where children can practice safe bicycling skills in a safe environment.
So it sounds like it's something that the whole family can participate in, whether they're out and about or they're just staying right at the senior center practicing skills.
Right, so we're inviting all families to come check it out from 10 to 2.
Awesome, great. Dylan, so this event got started last year and we're in the second year. Can you tell us a little bit about why it got started and maybe why it's important for people to participate?
Yeah, absolutely. So we're trying to really stimulate businesses, local businesses. We wanted people to get out and explore their town. And also we want people to, really try to be as active as possible. They've got these resources all around them.
Awesome. So it's a way for people to practice getting from place to place and maybe interacting a little bit with their community. Awesome. Very cool. So Alexa, can you tell us the basic details of when, where, and what's happening for the Bike Osh event this year?
Okay, Bike Osh 2017 is on May 20th, and it's from 10 a.m. to 2 p.m. And people can start anywhere in the city and go to their first pit stop based on their pedal pass. And everyone goes into the senior center, and that's where you do the raffle prize drawing.
Awesome. So we're hoping for really good weather, right?
Yes.
Awesome. So Ben, if people wanted to get involved with the Bike Osh event or participate or learn more information, how would they go about doing that?
The easiest way to find out more information is follow the Bike Osh Facebook page, or you can contact the Oshkosh Planning Department.
So Alexa.
Talk to Alexa.
If you wanted to download your pedal pass ahead of time, where would you go for that?
You'd want to go to rethinkwinnebago.org for that.
Awesome. So we hope to see everybody out around the city of Oshkosh on their bikes on Saturday, May 20th. The event starts at 10 a.m. and you can start anywhere you'd like or start right at the senior center and enjoy the bike rodeo.
Welcome back to Winnebago County Health Department TV show, where we talk about public health issues and connect them to your health. Those were some videos about some upcoming bike events that we're going to celebrate in May. Good job in those videos, Emily. Looked nice.
You're a roaming reporter.
Yeah, right? We have both of those events up on our Winnebago Health Facebook page as well. So if you want more information, feel free to log on to our Facebook page at Winnebago Health and you can connect to those details. But anywho, a proper introduction. We have Emily Deringer here. She is the co-coordinator for the Rethink Coalition. And today you're going to talk a little bit about what Rethink's been doing lately.
Yeah, so Rethink has been kind of going through a transition process over the last 6 months. We had a lot of great work that our partners have been achieving over the last several years, and we recognized that things have changed, and well, so that they helped make those changes happen. So it's good practice for every coalition to kind of take stock every couple years and say, are we still working on what we want to be working on? So we reviewed our mission statement and felt like that was still in line with what we wanted to do, but some of the priorities that Rethink had been previously working on kind of grew wings and started to fly on their own, or maybe we got enough things done that we wanted to get done and starting to look at some other emerging issues. So we held some different conversations over the last couple months. We just held some reset events. We like our kind of puns, so Rethink Reset events back in February. So to really give a good understanding of kind of where do we want to go now. We've got some new priorities identified, and that's kind of where we want to start working towards in the next couple months.
And you identified some problem statements on those nights. So what are you going to do with those problem statements?
Right, so the problem statements are related to our 4 new priorities. So
Okay.
Something related to alcohol, something related to healthy foods and beverages, something related to active communities, and our new and most exciting to me is a priority is a term called social and place connectedness. So our partners helped create these problem statements, and so this is kind of the problem. So then we're asking our partners, well, what do we want to do about the problem? So in coalition, usually you work on creating an action plan. So we don't want to just go ready, shoot, aim, oh darn, that didn't work. So we really want to take time to make sure that what we're planning on doing will actually make sense and will actually address that problem. So that's why we start with a problem statement, and then we come up with some solutions to those problems. So we'll work together in our teams and come up with action plans with some specific objectives and some specific activities that will address those problems.
And you work on things called PSEs. What are PSEs?
Right, so PSE, of course, public health has acronyms all over the place. So PSE stands for Policy, System, and Environmental Change. And that's kind of where you need a coalition to work on those kinds of things. So it's not something that one entity can do by itself, but it's things that multiple partners, multiple coalitions, multiple groups can work on together for the benefit of a larger group of people or a community as a whole. So some examples of policy, system, and environment changes. Everyone's pretty familiar with the statewide smoke-free air law. That was a policy change. Something that's maybe a little more local would be changing your school district wellness policy to include language around buying local foods or making sure kids have opportunities to be physically active during the day. So that's kind of a more local policy change. Other things like systems changes are things like the Connected Community Wellness Screen at our local high schools. They're changing how they do school, so that's a systems change by incorporating that Connected Community Wellness Screen. And then environmental changes are things that are literally in the environment, in the built environment. So a drug drop box at a police department is a change in the environment that makes it easier for people to get rid of their unwanted prescription medications. Or on the flip side, something that encourages people to be more physically active, like bike lanes and sharrows, are environmental changes as well.
All right, so you've got these new initiatives. We're working a new way. There were some older initiatives, the Heroin Task Force, mental health. Are you dropping those?
Well, yeah, right. So they're not necessarily old. They're actually so exciting and so emerging and stuff that so many people want to work on that they've actually kind of outgrown Rethink and started their own coalitions all by themselves. So we've got the New Mental Health Connection, and that's something that's a regional initiative, so it's bigger than Winnebago County. We've got so many partners involved with that, with so many different initiatives, that it needed the support of an entire coalition all by itself. So that's where mental health has gone, kind of partly related to Rethink and has really, really expanded over the years. Same thing with the Heroin Task Force. That kind of had a birth with some of our coalition partners with Rethink a couple years ago. Same thing, lots of exciting things happening on trying to prevent and work on treatment and recovery related to heroin and opioids. So they're having a new kickoff event. Whether or not you're seeing this before or after, it's on April 17th for community partners to get involved. And if you missed it and you want to get involved, you can connect with us at rethinkwinnebago.org. Just click the contact us and we can get you connected to that group as well.
Great. Well, thanks for coming in and giving us the update. It's just really neat to see the community voicing their needs to making this change and Rethink really taking that input and going with it.
Yeah, that's how people in the community can have a say in improving the health of their community, is by being a part of something like a coalition.
Great. As always, great to have you on, and thank you for joining Winnebago County Health Department's TV show, where we talk about public health and connect it to your health.